My name is Cornell McCullum III, DDS, MD. I am an oral and maxillofacial surgeon and a physician. The other dentists in the office here are my wife, Dr. Yetta McCullum, who is a periodontist, so her specialty is treating gums. Dr. Robin Ferguson, who is a well-trained restorative dentist, so her specialty is basically the general dental work. She does do some root canals, but we complement each other well just because of what we do. I place dental implants, that's a large part of my practice. Dr. Ferguson restores the implants. She places caps or crowns or dentures on the implants. The cosmetic portion of my practice has been evolving over the years, just as cosmetics have evolved over the years. When I first started providing some facial cosmetic procedures, Botox was not an approved entity, in the medical world. So it's funny to see how this evolution has occurred over the years. The Botox is one option for patients to help get rid of or minimize folds or wrinkles on their face. I use it for TMJ purposes for patients who have joint problems, pain, clicking, popping in their joint, which sometimes are caused by their occlusion, the way their teeth come together. Sometimes they're caused by grinding or clenching or stress. But I use the Botox to help relax the muscles that cause these problems. So patients get a lot of relief and results. Sometimes quickly, sometimes in a couple of days, sometimes it may take a week, but they definitely see an improvement. And it may not be 100%, but it definitely is enough to make their life a lot more happier. Other procedures I provide are repair of split earlobes from earrings that may have pulled through, keloids that may occur on the ears for trauma reasons or from a person who's had their ears pierced, mole removals in the facial area, which are basically done with local anesthetic or just a numbing cream. And they're pretty fast, quick procedures, what we call minimally invasive. There's minimal to no soreness afterwards.
My name is April, and I've been with Dr. Ferguson about 19 years, and with the Dental Dream Team probably about the last 9 years. I've had everything done. Every big monumental birthday, something's going on. Dr. Cornell stitched my ear before I went to Thailand. My ear had split, and he sewed it up for me. Then he did some other work for me, and they just leave you feeling healthy.
I think people should see their dentist at least 3 times a year. If there's more issues or more concerns, maybe 4 times a year. And that's kind of just for basic follow-up and maintenance and make sure there's nothing going on. For people who really have immaculate mouths and no problems and really take care of themselves at home, probably just twice a year is good enough. But I would say on the average, probably 3 times a year for the dentist to stay on top of what's going on. For myself as an oral surgeon, I see patients only a couple of times because I see them beforehand, before we plan a procedure. I see them before their surgery, and I see them 1 or 2 or a few times after, depending on what procedure they've had done. So I don't have that lifelong relationship with them like their dentist does. I get thrown into the mix every now and then whenever I'm needed.
It's very comprehensive. And so Dr. Ferguson will start a project, and then Dr. Yetta will come in behind her and maybe do my cleaning or do something with my gums to prep me to go back to Dr. Ferguson. And then Dr. Cornell, of course, is all about my vanity. So, but it's very comprehensive. So it's all about, for me, being healthy. And when you're healthy or taking good care of yourself, you feel good. And all of them genuinely care about you feeling good. Looking good, but feeling good at the same time. And so they consult with one another and they consult with me. And the other piece of it is they listen to me.
I think it's really very important for patients to be informed of all of their choices. A lot of times when patients aren't informed of their choices, they can't make the best educated decision.
We spend a lot of time giving patients choices, not trying to confuse them, but just letting them know that there's more than just one choice. Sometimes the choice isn't always clear, and we do make recommendations on what we think would be the best option. A lot of my patients just don't know what's going on in their mouths. They have no idea about periodontal disease, and that complimentary consultation that I offer is just basically my service of informing people of what's going on. They may not be at a point where they can accept treatment at that time, but at least they understand that at some point in time something needs to be done. So we do spend a lot of time educating people so that they're knowledgeable and understand what's going on. We're just not going to put some treatment on them. We don't like patients walking out not knowing what just happened. And when patients come to me and I explain what periodontal disease is, and then they go, oh yeah, I had something done like that, but I never really knew I had a gum disease. Sometimes dentists explain things, but it doesn't always stick. So even my patients, I have to constantly repeat so that they eventually get it, because it's hard to grasp everything at that first appointment. So we're constantly reinforcing things here at the office.
There have been other times that I've been with a dentist and I almost felt like they were upselling me, or like maybe I really didn't need that. And sometimes I would put it off, or I wouldn't listen, or I would just think like, you're just trying to, run up my bill. And I've never felt that with them. I've always felt that everything that Dr. Ferguson has ever recommended was absolutely in my best interest. And many times she would present two different options. The more economical option, or the immediate fix for right now, and then a long-term, more comprehensive plan for my dental health. Like, we're gonna do this now, but in 9 months you absolutely need to come back and we're gonna address this. And so we talk about what I can afford a budget for right now, and then what we're gonna go and what we're gonna head for later, and kind of get my mind around that. But I'm gonna be honest with you and tell you that I have never begrudged a bill that I've received from the Dental Dream Team, because it sounds kind of corny, right? But I've always felt like they've given me more than any place else. Like, they go way above and beyond, and they call and check on me. Like, afterwards, the next day after a procedure, they'll call and check and see how I'm feeling, if I've had any complications, or did I sleep through the night, or do I want to come back in, and they take a look at things. And so I've never felt like when I'm writing that check to pay a bill, like I'm begrudgingly doing it. I do it with pleasure.
My name is Sonia. I went there because my teeth was so messed up, I couldn't even smile.
Initially, when I saw Sonia, I knew part of her history from her orthodontist that had referred her, so he gave me a little bit of her history. I didn't know all the intricate details that, of course, she knew as being involved, or as her parents knew. But I could tell during the initial consult that there were certain things. When she would talk, she would look away from me, she wouldn't make eye contact, or she'd have her head down, or she'd put her hand over her mouth.
Well, my brother, Devon, he used to pick on me about my teeth. He used to call me like toothless or buck tooth, all those names, and I just couldn't take it.
And our plan for Sonia was to do something called FAST. It has a variety of names. It's called FAST Ortho, or AOO is an abbreviation. But it's basically going through orthodontic treatment, but in a much shorter time frame than most people are used to, which could be anywhere from 2 years to 3 years to 4 years. With this procedure, patients are out of braces on average about half the time. And we wound up with a great result with Sonia. I don't know if you ever see slides or pictures of her actual surgery, but her surgery was done with local anesthetic. Sometimes patients have this procedure done and they're sedated. Sometimes they're put to sleep or have general anesthesia. Her surgery was completely with just local anesthetic. She was just numbed up in the area. She was out of braces in roughly around 10 months or a year. But if you see before and after pictures, you're amazed at what she's been through, and then I'm sure it's changed her life.
It's amazing. It is amazing. How much work I had to go through to get this smile. It took a lot of work to do. So now I don't have to wear no brace no more. I can smile, I could do this, I could do that. And I don't have to be picked on no more ever again, because I got the smile now.
My name is Chelsea, and I've been coming to the Dream Team for about 10 years. My husband was one who encouraged me to go. I never liked dentists. I've always been afraid to go to the dentist.
My name is Charles. I've been going to the Dream Team since they acquired that practice, I would say 8 to 10 years. My wife has been my wife for 50 years, was one of those who tried to avoid going to the dentist. I kind of talked her into going there. She was a real chicken, but I think now she has a rapport with the people that makes it a little easier for her to go there and for her to go through the procedures, and she's happy there.
The doctors there, they make you comfortable. And Dr. Cornell asked me, "Are you all right?" "Yes, I'm all right." "You want a few minutes to relax until you get your nerves in there, you know?" Yeah, your blood pressure seems to be a little up, because he does take my blood pressure occasionally. And I said, "Well, I'll take a few minutes and relax. And then it's all okay." He was the one who did my first implant. He says, "Your teeth need work." I said, "Implants?" I said, "Charles told me about implants. I don't think I want implants. You're going down in there and drill and you're going." He says, "Don't worry, I'll take care of you." He said, "You can handle it. You can do it." And he made me aware that I could do it. Dr. Yetta says, "You need laser. We need to scale your teeth. We need to get down there." I said, "What is laser?" I said, "You're going to put," she says, "No, it's very easy." And it was. They called, they asked me, "How are you doing?" I said, "I'm doing fine." "Do you need to?" "No, I don't need to talk to anyone. I'm okay."
All of my experiences have been good, all of them, and I've had quite a few. They're professional, but they're professional in a way that let you know that they're friendly with you. It's like enjoying going to the doctor in a way. Not totally, I won't do handstands, but I don't mind.
It's great to have patients come in that are a couple, to treat them as a couple, because we can take care of the gum disease and get all of that under control at the same time. They're unique because they are on a fixed income. That was a perfect case of, you know, we gradually will get through their treatment. In both of their cases, we just did a segment of dentistry at a time. You know, we may have done the upper right side one year and then went to the upper left side the next year, but it was so they could be able to afford it. A lot of times patients are overwhelmed by the cost, let alone the time and what needs to be done, but I think the cost just kind of throws a lot of our patients like, "I can't afford to have this done." But when you sit down with them and you explain to them when it's possible, I'm not saying all cases are this way, but a majority of them, if you plan correctly, you can take a segment at a time. You can do a portion of the treatment at a time so that they're able to get through that treatment. We may not be able to reconstruct the whole mouth within a year. We may need to spread it out over 2 or 3 years. But again, it goes back to that comprehensive care, that full treatment plan, planning out with the oral surgeon, planning out with the periodontist, planning out with the orthodontist, so that all that treatment can be taken care of.
My name is Carolyn, and I was blessed to find this dentist. One of my choir members gave me the referral, and I went, because I've been going to different dentists for years, and I have a bad breath problem. And my sister would always tease me, and she'd always have mints for me and these kind of things. So she was highly recommended, and I went, and then she did a laser treatment, not just so much the gum treatment, you know, with the apparatus that they use, but of a laser. And my gums used to bleed. All my teeth used to bleed when I would brush my teeth. So along with the bad breath and the bleeding was got to be such a problem. So I went to her, and first treatment, I mean, she did the laser on one side, gave me the full directions written out on, you know, what to do during the course of its healing, and then I went back for the right side. And my teeth have not bled since. I mean, my teeth, when I would brush my teeth, there would be blood just everywhere. So my teeth haven't bled anymore, and my breath is the bad breath is gone completely. So I can smile again.
Periodontal disease has a few signs and symptoms. One is bleeding gums, and you can have a bad mouth odor. But periodontal disease may not be the cause of mouth odor. I have a lot of patients that come to me thinking that they have this foul odor, and they're popping mints, chewing gum, doing all kinds of things. They've been to lots of different doctors trying to find the source of this odor, and their mouths are perfectly healthy. So halitosis, or a bad mouth odor, can be caused by periodontal disease, but there are other causes also.
I have been to a number of dentists. It's like, okay, have a seat. And, you know, they don't even tell you what they're going to do, what the, you know, we're going to do this or that. They just, you know, just start the work. But with the dentist's office, they explain step by step, and that's important. I want to know, you know, what are you going to do? I was very comfortable. I think that the professionalism is great. They really, I mean, explain step by step about the laser, because when I heard laser, I was like, oh my God. But they explained it, and it didn't hurt at all. And the main thing is, I just thank God that I don't have the bad breath anymore and the bleeding of the gums.
In general, a periodontal patient usually is on a quarterly recall for maintenance, just to make sure things are staying stable. Because if you've been diagnosed with periodontal disease, the type that is the bone loss, which is periodontitis, if you've been diagnosed with that, then it's about management, because you'll never be cured, so to speak, but you can be well managed, just like hypertension can be managed, diabetes can be managed, but you need to follow up with your physician. The same thing with your dentist, hygienist, periodontist, about every 3 months.
It was important to put my money where my mouth is. Health is important. If you're going to take care of your body, you have to take care of your mouth as well. It's one of those major things that you do. Most people aren't aware, and I was not aware either, of the effect that oral hygiene has on the rest of your body. So it's good and valuable to invest in your mouth.
It was important for me because my previous dentist said that if I did not get this work done, there could be substantial damage done to my mouth and I could lose other teeth. So this was really a no-brainer for me. I wanted to preserve all of my upper teeth. I had to get this work done, so it was important for me to go you know, to a practice where people knew what they were doing.
Maintenance for a patient is extremely important. Maintenance in regards to hygiene, meaning the cleaning or keeping the gum disease under control, is critical. It's critical no matter what you've had done, whether you've had one filling done or a full gamut of treatment of crowns and implants. It's important. It's important for twofold. One, it allows the hygienist to clean all the buildup and tartar away from your teeth, and allows us to monitor how your crowns or how your teeth are progressing from a 6-month period interval. It also allows the hygienist to inform me as the restorative dentist if anything is changing. So it is highly recommended that patients come in at least twice a year to see the general dentist to look at all of the teeth and all the restorations or crowns or fillings and check all of them, as well as coming in to see the hygienist to have the teeth cleaned. Some people will be on different type of intervals, whether it's 3 or 4 or 6 months, but it is essential that the patients come in, because if you don't come in, things will get out of hand. Not only the gum disease will get out of hand, but if you're having any problems with your teeth, that also will get out of hand, and then it becomes more costly.
It's important to put your money where your mouth is. Teeth are one of the things that I look at. When I see a person, I see their mouth, and then I see their face. And to have cavities or unattractive teeth, it just distracts from the whole personality. And I do think that when your teeth are the way you want them, that you're more relaxed, that you're more comfortable, that your presentation of yourself is different. You see a lot of people who talk like this, and when they finally remove their hairs, you know, you go, okay, I understand why you did that. It's important to invest in yourself.
We offer a maintenance program with one of the best hygienists in Chicago. She is very meticulous, so when you come in for a cleaning with LaShonda, you know that something's just happened. And so we do offer that service, and a lot of patients, they set their clock by their appointment with LaShonda. And maintenance is really important. It allows us a chance to check in with the patient's oral health, make sure nothing is happening that they're not even aware of yet. Ideally, we catch things early. Sometimes we miss things, but invariably, we're able to treat patients before they're losing a tooth or losing an implant. So the maintenance care that we offer is essential to overall health. And my hygienist and I consider ourselves the maintenance crew. I mean, we basically are responsible for all the work that Drs. McCullum and Ferguson do. We've got to make sure that it stays healthy. And if we notice any problems, we call them over so they can get on top of things early.
For maintenance, I go in for cleaning every 3 months. Previously, after I had the first gum surgery, it was not a good experience. I had to be injected and with local anesthesia every time, and it was just not good at all. But I don't have that this time, and I'm so happy. And that's the only reason why I go in every 3 months, is because I don't have to have injections just for deep cleaning. But they call, they set you up, they make sure you're set up after every appointment. They call, 1 or 2 days ahead of time to make sure that you know that you're supposed to come back in. It's interesting, they make you feel like you're part of the it's like one big family. They make you feel like we're glad you're here, we're glad to see you again, that kind of thing. But that's my maintenance program, to make a long story short. It's every 3 months.
I think appearance is important, whether you're going on a job interview, whether you're going on a date with someone. And no amount of jewelry, no amount of Gucci or any of the other elaborate makers of clothes is going to diminish a smile. If you smile and your mouth is jacked up, people are going to look at that and say, well, if you spend all this money on your Louis Vuitton or your Gucci bag and you're not spending it on your mouth, there's an issue there. So maybe their priorities aren't really where they should be. I think a mouth is very important, of course, not only because I'm a dentist, but it allows you to eat properly. It allows you to function properly. It's just very important no matter what age you are, whether you're 15, 16, 30, 40, 60, 70, your mouth is important. And so it really should be taken care of, and that's one of the first things that people look at is your smile.
I go probably every quarter to get my teeth cleaned, and I go twice for dental checkup. Dr. Yetta comes in when I'm getting my teeth cleaned because the technicians that clean the teeth report to her. She comes in and looks about every visit, and she gives recommended hygiene care that I should perform or do, and she looks at it and she talks to me. Then Dr. Ferguson, she does x-rays every so often, and she herself gives me advice on what to do, and occasionally scold me with certain things that I don't do, but it's all in fun.
I come into the office and I see a patient for a consult, and I look in their mouth and they have a couple teeth over here and a couple teeth over here, but they're missing a fair amount of teeth. And I asked them, I said, well, how well do you eat? Well, I eat pretty fine, pretty well. I said, so how can this guy with 8 teeth be eating pretty well? But it shows that people become adjusted to and learn to live with and get along with. What they've forgotten is how they used to eat when they did have all their teeth. So that's what we try to get patients back to. Patients who are missing all of their teeth, they already have upper and lower dentures, but they're unhappy with them for different reasons, because they move, because they click or clack when they talk. It may make them feel like they're gagging. They don't like using the adhesive to hold them in because they feel like they're swallowing or eating adhesive all the time. So there's a lot of different issues with what we call full dentures or conventional dentures, and the implants help get around a lot of these problems. So the patients that had dentures and they come here looking for something better, that's what we try to provide for them.
I had 3 implants with 4 crowns. It took about 18 months, and here's why. He determined that my sinuses were sagging. Also, I needed more bone to form the foundation. So what he had to do was create more bone. And he did that, not with artificial bone, which takes a long time, but he took a bone substance from another part of the jaw, and he used my own blood. Sounds gory, but it isn't, because that provides the quickest healing and the most long-lasting foundation you could have. So the surgery was to go in there, perform that, and then you have to wait, I've forgotten how many months, but you have to wait like 9 or 10 months for that to really heal and solidify. My wife and I left here, and I felt no pain. On the way home, we stopped at our own neighborhood in Hyde Park, and I had a full meal. This is like a few hours later.
I think having initial consult, for me, a pre-surgical planning visit is extremely important for patients because we can talk about the procedure. I can give them an idea of what to expect. I give I paint a pretty true picture of what to expect because I don't want the patient to feel surprised. I'd rather them know that they can trust me, that I'm being honest with them, so I don't want to paint things rosy if they're going to have soreness after the procedure.
The implants that I have feel like real teeth. You don't really feel your teeth. There's something there, but that's what they feel like. They don't feel different. They feel just the same as all the other roots, because an implant is the root, not the crown. And that root feels just like all the other roots. And in terms of care, the same care, flossing every day, brushing of the teeth, the maintenance is the same. And mine, the process started in the fall of 2003. It was completed 18 months later, which would be 2005, and they have held steady, firm ever since.
Make us your wise choice. Choose the Dental Dream Team.